Hi, I'm Dr. Colin Elkin, and I'm a practicing chiropractor. I've been in practice now for over 25 years. And over those past 25 years, I've seen literally thousands and thousands of patients come in to see me with many different health complaints. But one of the most common things that I hear on a day-to-day basis are people with complaints of pain down the arms or down the legs, or perhaps both. It may be on one side of the body, it may be on the other side of the body, or maybe on both sides of the body, in the arms and the legs together, or just singly. However, many times those complaints of pain are in the form of numbness and tingling. It may be burning pain, maybe radiating pain, but it's such an annoying thing. It can be debilitating for people. It can totally ruin their lives, can affect their function, can affect their relationships, can affect their work life. It's a very serious condition. In most cases, when I do an examination on those people, I find irritation on the nerves that travel down the legs or travel down the arms from the neck or from the lower back, where the spine has literally shifted out of place. Chiropractors call it a very unique word. We call it subluxation. And subluxations, when they happen, can be devastating to human health. Not only can they cause pain, but they can put pressure and irritation on different nerves going to different organs and systems in the body, which will totally decrease function and the body's ability to heal. Our job as chiropractors is to find those subluxations, and we use a various number of tests in our office, including x-rays, including thermographic neurological scans to see how the nervous system is functioning. And by using those tests, feeling the spine, observing the posture, measuring ranges of motion of the body, the cervical spine, the lumbar spine, all of the different joints, we can really determine where those symptoms of pain are originating from, which gives us a lot of tools and a lot of information to be able to say, this is exactly what we need to do to correct the problem, get to the root cause. So instead of treating the symptoms with some sort of medication or some sort of surgery, a very invasive approach, we like to take a much more natural approach by correcting the alignment of the spine, removing the subluxation, taking pressure off of those nerve roots, and allowing those nerves to flow the way that they're meant to flow. By doing so, we improve the communication between the brain and the rest of the body, and thus healing and function can be restored. I've seen those thousands and thousands of people in most cases get fantastic results by correcting their spine, by making adjustments to their spine, and then by doing retesting down the road to not only see that their symptoms have improved, but also that their function and the alignment and what's going on in the inside of the body has also improved as well. So that we know not just the person is feeling better, but we know that that person is actually functioning and truly healing better. If you've been having some of these symptoms like numbness and tingling, pain down the arms, radiating pain, burning, tingling in the toes or fingertips, loss of muscle tone, or perhaps weakness on one side of the body, or both, if you're finding that your health is just not as good as it used to be, or you feel like you're on the decline, this is absolutely something to get checked. We've had so much great success by getting people on programs of chiropractic care, specific corrective care to correct the alignment of the spine, remove those subluxations, get those nerves functioning better, and really truly restore the body's ability to heal. If you've never been to a chiropractor, you may have heard lots of stories, perhaps some stereotypes, or maybe you have some fear. Well, I just want to reassure you, people of all ages get chiropractic care. We see infants, we see very elderly people, and everybody in between, males and females. It's very safe, it's very natural, and one of the things that we always assure every patient is we go through a number of tests to make sure it's absolutely safe for them to receive chiropractic care. I would never care for anyone if I didn't think it was 100% safe for that person to get care. The care we provide is very gentle, and most people really enjoy getting their spine adjusted. It gives them a feeling of relief, It gives me a feeling of euphoria, and it really does improve their function almost immediately. Many of the patients in our office have been there for many, many years, not because they have chronic pain, but because they like to maintain the correction that we've made in their spine. Because they come in on a regular basis, get their spine adjusted, it's like regular maintenance for any car that you may have. It's like regular dental checkups. It just keeps them functioning well and really prevents a lot of injuries from occurring. I really do encourage you to get your spine checked. Whether you have pain or whether you don't have pain, it doesn't matter. If you do have subluxations, it could be affecting your function, and that may not even be sending you any symptoms or any signs right at the current time. But your body may be breaking down on the inside without you even knowing it. It's worthwhile having it checked. I invite you to come into the office, have an exam, have an x-ray, figure out exactly if there are problems that need to be addressed, and then we can talk about what needs to be done to get them corrected. I'm Dr. Colin Elkin. I welcome you to Elkin Natural Health Center.